I'm your host, Carolyn Solo, LCSW EMDR therapist and mom of 3 daughters. Thank you for joining me.
Hi, everyone, and welcome to episode 87 of the Future Template Parent Podcast. I'm your host, Dr. Carolyn Solo, PhD, LCSW, EMDR consultant, and mom of 3 daughters. I am really excited to have a special guest here with me today. I will briefly introduce her, and then I will have her give you a more thorough introduction, not induction. This is Sam Sarty, who is a registered nurse and a licensed clinical social worker, which is a cool combination. And she has her own private practice in Halifax, Nova Scotia. So, Sam, why don't you just tell us a little bit about who you are, what you do, kind of your EMDR journey, and we can go from there.
Totally. And if I'm being inducted into something, I feel like that is totally cool because I absolutely love your podcast. So it's like a Hall of Fame moment for
Yes.
me to be on here. So I'm absolutely cool with any introductions or inductions. But yes, hi, everyone. My name is Sam. I use the pronouns she and her. Nurse and social worker living in Halifax, Nova Scotia, Canada. That's the East Coast for those who don't know. I'm a white, Indigenous, able-bodied, queer person who runs my own solo private practice here. I've been in the field for about 12 years, and my passion at the moment is working with first responders, helping professionals, so like other therapists,
Awesome.
nurses, physicians, etc. However, I welcome anybody who wants to heal from trauma, of course, as long as it falls within my competencies. I work 3 days a week in my private practice, so Monday, Tuesday, Wednesday, and I do kind of a combination of hybrid in office as well as home office. And I really like that. I've been an EMDR therapist since I think I did the basic training in 2020. It was definitely a COVID time, so I did it online through Roy Kiesling's program, and it definitely was a therapy that kind of took me some time to kind of roll into, but now I'm absolutely hooked.
Yeah, same. I was very suspicious of EMDR when I
Yes.
first did the training.
Me too. It's so funny, right? Like, whenever you do those trainings, like, you try to come in with an open mind, and obviously you're paying like a ton of money to do the training, but I also was definitely a skeptic at first. And it's so funny. Like, I think about this all the time. Like, when I look back on the modalities I practice with the most right now. So I do like, obviously I do EMDR, like I just said, and I also do like the IFS infused
Mhm.
EMDR, and I was also very skeptical of that. So
Yeah,
basically
yeah,
what I've learned is just to have an open mind as long as there's, some solid rationale for doing it, just give it a
right.
try and see if it fits with your practice.
Yeah, and like that you can take what you want and leave what you don't a little bit.
Hmm.
I think that, we're taught these modalities the way that they were created for good reason so that we learn them, we understand them, and we bring our own selves to the practice. So that's important, I think.
Yeah, love the way you frame that. Yeah, bringing yourself to the practice and yeah, taking what you like and leaving what you don't.
Right, right. I remember reading one of Laurel Parnell's books, the attachment focused EMDR book, I think. And
Yeah.
she talks about how she with clients with CPTSD, she often won't use numerical scales because
Yeah.
it gets them kind of out of the right brain state and getting very focused on like, oh, what is it, a 7 or is it an 8? Like, and or not asking people for a positive cognition at the beginning, because what if they can't possibly imagine that there could be a positive cognition? I remember like reading that, it made so much sense to me. It felt very liberating. Like, oh yeah, in an ideal world, maybe everybody would follow this protocol exactly, but there are going to be times where it's okay to let pieces go and you're not losing the spirit and the intent of the practice.
Absolutely. And I mean, I'm probably like preaching to the choir because I'm probably 99.9% of the people who listen to this podcast, unless they found it accidentally, are EMDR therapists. But that's honestly like what I like the most about EMDR. Like I say to people all the time, like, I don't believe that EMDR is like the best therapy out there
Right,
or the best one for me. But what I love about it is how flexible it is and how Dr. Shapiro intended it to be modified with intention, of course.
right,
And I find that it just lends itself so nicely to all the other therapies I've been practicing over the years. And so I can kind of integrate things so seamlessly versus in,
right.
previous modalities that were more manualized. It was more of a rigid prescription. I felt that if I were to go off book, you were drifting and kind of
Right.
labeled as like not being compliant to the treatment. So I just love that
Right.
about this process.
Yeah, me too. Me too. I agree completely. I did just diverging slightly. I am really interested in what was the process in terms of when did you become a nurse versus when did you become a therapist, and how do you see the two of that? Do you maintain your license as a nurse as well? I'm curious about that.
Totally. Yeah, that's probably one of my most commonly asked questions. So, yeah, I started as a nurse first,
Mhm.
and my whole career has been in mental health nursing. So, I started
Okay.
working my first year or two with pediatric psych in the hospital, as well as in an outpatient program for adolescents with concurrent disorders, basically. I don't like that word, but you know what I mean.
Mm-hmm.
And then, yeah, I went to the adult side because I found just being in that more traditional nursing role where, like, of course you're doing a lot of therapeutic interventions with the youth, building rapport, establishing trust. You do a lot of like safety planning and like crisis intervention, behavioral analysis, etc. It just
Mm-hmm.
kind of wasn't really fulfilling me to my full scope of practice that I wanted as a young nurse. So when I had an opportunity to go over to work with adults, it was more as a clinical therapist role. Like the main role is providing therapy, and sometimes you would do some long acting injections for folks who are on like the severe and persistent mental illness spectrum, so like antipsychotics and stuff.
Mm-hmm.
And yeah, so like from 2016 onward, I've just exclusively done therapy as my job. And basically, what I found was all this work I was doing as like a mental health nurse was within our public mental health system. Because in Canada, you know, everyone is kind of entitled to therapy or mental health services, regardless of like insurance coverage and stuff. And then more of the private side of things, people may have benefits like if they work for the government or through their employer where they may use for like private physio or psychological services, etc.
Mm-hmm.
So what I was finding is I always wanted to kind of have my own clinic of some sort, either as like a nurse practitioner or eventually as a therapist. But then when I went over to the private side, I was working for a group practice for a psychologist, and there were just some barriers with people who wanted to use their extended health benefits with billing. Basically, what was needed was like a code under nursing for psychotherapy. There'd be codes like foot care or like nursing assessments, but there wasn't one
Mm-hmm.
for psychotherapy. So that kind of blocked me from potentially reaching all the clients I
Mm-hmm.
wanted to work with. So
Okay.
that's why I decided to go back and do my master's in social work because one, I aligned with a lot of the social work values,
Yeah.
as well as it was a way to kind of meet my goal to be able to not have as many barriers to offering the kind of services I wanted to provide, basically.
Oh,
So that's
cool.
the kind of the short story of how I kind of integrated both. And because I work so hard for my nursing license, although while I
Mhm.
don't need it to practice privately, I'm just never going to let that go. And because there is an overlap in the practice, I'm still legally counting my hours as a nurse. So you'd
Okay.
have to pry that from me. I'm not ever canceling that license because it's so much
Sure.
work to get it back.
Absolutely. And I completely understand that. And I agree. I think it's great because you can bring that trained medical lens that I don't know, most of us therapists don't have that thorough medical training. So I can see that's really, really valuable too.
Absolutely, yeah. When it comes to like, medications, monitoring, side effects. I obviously don't give medical advice, but if there was something that were to be going awry with someone like serotonin syndrome, then I would be maybe more aware of that than
Right.
what social workers get trained because that wasn't really talked about at all when I did my master's degree in clinical social work. So
Right.
yeah, it's definitely helpful, and I also appreciate how in social work school they did a lot more education on like decolonization and like two
Mhm.
eyed seeing, like bringing Western and Indigenous practices together, and even
Right.
like in nursing school they talk about social terms of health, but nowhere near to the extent of like in social work school. So I really
Right.
found that was a really great education to have when working with clients.
Awesome. Awesome. Well, thank you for sharing about that journey because I think it's unique. Not a lot of people have those two degrees, but I think what an awesome marriage. Hate that word in these contexts. What an awesome bringing together of, two fields that don't often talk to each other, even though they need to. And I imagine that being a nurse certainly had something to do with your interest in working with first responders. So I'd love to hear a little bit about that and also maybe a little bit about how you see that working with EMDR and even EMDR intensives. So,
Totally. Yeah. It's definitely a different lifestyle when you're doing shift work, as well as like, when you're working with a lot of folks that are in crisis now. I mean, in my very brief role as a nurse, I didn't identify as a first responder, but definitely like was doing like frontline work, and it's
Sure.
definitely helped me have more of an understanding and appreciation for that lifestyle, and trying to balance all the things like parenting or like socialization and hobbies and leisure and work life balance and all those things, especially where like you're constantly short staffed and you're always
Mm.
you're my phone would be ringing off the hook, always asking for like, can you come in for this shift or that shift? Or
Right.
it can be quite a cycle to get caught up in, as well as I didn't feel this as much myself at the time, but what a lot of first responders experience is like that guilt of like respecting like boundaries and saying no, because especially where you're doing really high stakes work.
Mhm.
Um, then there's like kind of the feeling of like I'm potentially they are feeling that responsibility of like putting their partners or colleagues more at risk if they're short staffed, which of course is not their responsibility or burden to
Sure.
bear, but it can come
Right.
with the territory. So I
Yeah.
definitely could appreciate that a little bit more with my experience in nursing, as well as one thing I did mention is I did like a few years as a sexual assault nurse examiner, where I worked more closely with law enforcement as a forensic
Mhm.
nurse, and so
Mhm.
working more intimately with them, kind of getting to know them a little bit, and developing some relationships with law enforcement was also what kind of piqued my interest when I had an opportunity to work at a federal funded clinic for veterans, military, and first responders. So that's kind of like I was
Yeah.
always interested, but that's kind of how I got into it. Was I was offered a job at a federal clinic where we worked
Mhm.
with basically like our kind of equivalent of like the FBI. Um, in Canada, as well as
Mhm.
military members and veterans, of course. So
Wow.
yeah, I mean, it's a great honor to work with such a highly regarded population, and also um, I have learned so much just about trauma and systems and all the things, just like working with all the nuances that can come up in those fields. So it's
Sure.
been very humbling and also very motivating, because we're just always learning. That's just really reinforced that.
Absolutely. Yeah. Yeah. And so do you find that EMDR is a, I mean, it sounds like you, okay, let me roll that question back a little. What percentage, and not exact, would you say are like first responders in that sort of general field that you work with? And what do you find the experience of working with them using EMDR is like?
Are you asking like how many of my clients right now are like in that field?
Yeah, I'm just curious in general. Do you, how
Mm.
many people do you think you pull in that are in that category, and what's it like doing EMDR with them?
I would say like right now my care load is like 60-40 for like people in the first responder field, and
Okay.
40% would be like civilians. It could be higher. However, basically when I started I started my practice in 2023, I probably should mention that in like our introductions, when I was coming from my mat leave, and then I filled up really quickly. And because I do kind of like a lot of like ongoing long-term psychotherapy, just by like, the nature of the
Sure.
work that we do with those types of clients. I've definitely been asked and reached out to many, many times. And had I said yes, it probably would be now more of like an 80-20 split. But
Mhm.
it's a nice balance for me right now. So, like, I
Yeah,
definitely have a lot of connections in the various kind of agencies that would refer first responders, as well as like word of mouth, and like doing,
mhm,
I
mhm.
do corporate workshops as on like psychological resiliency with some law enforcement agencies as well. So my name is kind of
Cool.
out there. So that's been really helpful for like, you know, marketing or referrals and stuff.
Absolutely. Yeah.
And then, sorry, I forget the other question that you asked.
Well, what is it like to and I know there's no way to paint this with a broad brush really, but what is it like to work with that with sort of first responders using EMDR? Because
Mm,
I could imagine maybe there are some things that feel unique or I'm just curious how that population responds to it, all that kind of stuff. What's your
absolutely.
experience been? Yeah.
Yeah, that's such a great question. So I find there's a few like clinical challenges, if you will, or
Mhm.
kind of nuances that one needs to be mindful of when kind of approaching the population. Um, it seems like with this population, especially, I mean, this could go for anyone, of course, but especially with this population, trust is really earned, not given. And it
Mhm.
really helps
Mhm.
to almost, I kind of call it like a bit of a warming up phase, like even before you kind of, or as you're, doing your assessments and kind of having those initial sessions. I find a lot of folks are more receptive with just kind of getting to know them as people and not just kind of going right in with some of our assessment or history taking questions.
Yeah.
Like especially with this population, as well as they seem to really appreciate and value having a sense of like cultural awareness of some of the different nuances, like kind of like I mentioned with like the bind they can find themselves in with like leaving their colleagues short staffed or what have you,
Mhm. Mhm.
and some of the systemic issues within these organizations. It seems like folks really appreciate that as well and having some knowledge of the role, because they often find that like sometimes therapists can be kind of like nosy or even just like unaware, and then they feel like they spend more of the therapy session trying to educate the therapist or explain
Mhm.
things than like
Mhm.
actually having like a therapeutic
Mhm.
benefit. So I find
Absolutely.
that is really important to be aware of. And I see people post in groups like, what trainings should I potentially get for working with first responders? And I know you talk a lot about like the RTEP or like the press C and the assist. I find those
Mhm.
are really helpful because obviously like
Yeah.
there's a lot of acute incidents as well as like the ongoing stressors. Like unfortunately, like you can't
Right.
just say like, yeah, you're safe always because
Yeah,
that's like,
right. Exactly. Exactly.
honestly, you're going to be in some potentially, dodgy and risky situations as a first responder. So I think those are great trains to have, as well as some of the early trauma protocols and
Yes.
like the attachment
Yes.
focused. Um, like I mentioned, I'm in my parts era. I'm just really into like the ego states, like the Robin Shapiro
Mhm.
stuff, and like
Yeah, yeah,
the IFS integration of the
yeah.
EMDR
Mhm.
protocol. So I find that stuff is incredibly helpful, especially where a lot of my clients, not all, but a lot of them have like more of the avoidant attachment
Mhm.
patterns.
Mhm.
And so sometimes that can really create a lot of those blocking beliefs that we can run into that can be
Yeah.
a little bit tricky. And so I found that's all been really helpful. I was very naive when I first went into it. I mean, I shouldn't say very naive, but I kind of like, when you think of a first responder, like as a therapist, you're like, oh yeah, you're going to be like, doing like a lot of critical incident debriefing, and like you think of the types of calls that paramedics and police officers would go to, and you're like, oh yeah, that's like we're going to be right in there. And
Mhm.
while that is true, I did not at all appreciate how much of the heavy lifting would be around like the reasons why people potentially may have joined the field.
Ah,
Like
yes.
why
Sure.
they became a helper, and all that
Mhm.
really vulnerable childhood stuff that I think that
Yeah.
a very zealous and enthusiastic and therapist that has the best intentions can easily forget about when you're doing
Right.
the history, and especially since they will, you know, there's a part of them that doesn't want to go there, so they might diminish or downplay those things, like
Mhm.
anyone, honestly, any one of us would do, but especially in those situations. So
Right.
yeah, I just love all the nuance.
Mhm.
It can get easily overwhelming just because like you could potentially have like six different target plans and all the traumas may be thematically different. But I just love just getting right in there and like learning and growing with the clients and supporting them on their journey. And
Yeah. Yeah.
yeah, it's just really interesting and really rewarding work, and it's never boring.
Yeah, I'm sure. And I think from a parts perspective too, and I think this is true for anyone, but like how we compartmentalize our work selves, right? I could see that being something that is almost, an essential thing that if you work in as a law enforcement or whatever, but then you still do have to come home to the rest of your life. And compartmentalization is great, but it also, like, it's an essential survival strategy, but it also has, repercussions for the rest of your life. So I can imagine that is something that you have to navigate too.
Absolutely, yeah. They're really effective at using all their training and their survival skills. However, it seems like a lot of members and retired members have told me that they're not trained how to transition out or how to kind
Mhm.
of defrost from that work, and that's where you
Right.
can kind of end up with a myriad of
Sure.
challenges. When it comes with like family life and yeah, balancing all those parts, all those roles that
Yeah,
they have to kind of balance, right?
absolutely. Yeah, yeah, yeah. It's fascinating. So switching a little bit to intensives, so tell me a little bit about that journey, and I know I'm so excited to hear this, and I know other people are interested in this too. You're starting to offer kind of these more holistic retreat type intensives with other practitioners involved and stuff. So just generally about, what intensives are like in your practice and how you're kind of making them your own, and interested in hearing about that.
Absolutely, yeah. So Carolyn, you are the inspo formal
Thank you.
intensives. I definitely would not have been brave enough to, dive in without you. And it definitely
Oh,
wasn't
that
like
makes me
I'm gonna
happy.
do like a 3-day, like 18-hour intensive right away. Not at all. I don't think that is wise to do that. I started off very gradually just by doing extended sessions because a 2-hour
Mhm.
session isn't really like an intensive. It's more of
I
just like a
agree.
longer session.
A lot of
So I
people like
just
to call them that, but I don't think so. But yes.
yeah, just like, it's just like a, a very micro intensive, or just like
Well,
I think of it as like a longer session.
I kind of think of it as like, I feel like 2 hours is kind of like, I don't like to do one sessions that are much shorter than that if I'm going to be doing
Hmm.
phase 4. But anyway, yes, yes,
Yes,
yes.
absolutely. So I just, from
Yeah.
someone that was doing mainly, 50
Oh,
minute is
sure.
standard in Canada,
Longer.
50
Yeah.
minute sessions, or like sometimes 75-minute. Going from that to the 2-hour mark was like a big jump for me. And I was kind of trying that out with like my existing clients who were,
Hmm.
appropriate, of course. And
Hmm.
a lot of them were like first responders, just in like the rationale behind that was, allowing them to have more time and space to kind of like get into their body and out of the cognitive
Exactly.
sphere,
Uh-huh.
as well
Uh-huh.
as just simply like the sheer amount of um, targets on the target plan, just like, having more time to kind of get in there. And sometimes there's a lot of pressure just to kind of get in like the heavy hitters, like the first, worst, most recent, or you're going through all those past targets. But now it's like, okay, we have more time to do the present and future, like if you're doing like the three-prong approach, right? And future templates as well. So that was just like such a nice, addition to our work, because sometimes it felt like, we're like, okay, if we only have like, we're only funded for this much time and we're only meeting hourly, like you kind of try to go right in for, what's really bothering them the most. So that
Right.
was really helpful for that part of that population as well. And then over time, as I, got more confidence and more, kind of more of an idea in my head of like how I'd want to be structuring these intensives for most of the clients I work with, and how I'd modify them. That's when I kind of started to work up to offering them for current clients, and then eventually new to me clients with like, playing it a little bit cautious, like, definitely not pushing the envelope in terms of um, anything that I was kind of worried about could come up, like kind of keeping it within the safe zone, like not, for example, like, not taking on clients for intensive with like DID. I know that someone like yourself who's like very experienced and comfortable might do that and structure it a certain way. But for
Yeah.
me, I was like, mm-mm. Like I want
Yeah.
to make sure that this is like still safe and competent and like good care. So I kind of worked my way up. And then with the retreat intensive idea and kind of integrating other services, it kind of really happened organically because my office space, because it's just me, I'm the only therapist in the shop.
Hmm.
I rent my office space from actually like a holistic health clinic.
Oh, cool.
So
Okay.
I share the space, but I don't use their admin. I'm not really on their team, but they are very kind to me. Shout out to the Dartmouth Wellness Collective. And so they have, chiro and like a naturopathic doctor and acupuncturists and massage therapists on staff. So, it was already on site. It was kind of already there. I
Yeah.
would suggest to clients,
Sure.
like, no pressure, but if you like, you may benefit from, having a massage before or in between, some sort of treatment in between intensive days if you're up for it.
Mhm.
No
Mhm.
other obligations, of course, but if that feels restful for you and you're comfortable with it, it's there. And
Mhm.
so, yeah, sometimes people will book in with those providers, as well as with the retreat location. So I saw a local business. Airbnb is pretty popular here in the province. That, yeah, a local business kind of started this Airbnb that had this just gorgeous, like, fully renovated house, as well as like hot tub, saunas, cold plunge, fire pit, just like a beautiful space.
Wow.
And that caught my eye, and I just kind of like had the thought, like, wow, like, wouldn't that be nice to have that just as an option for doing the
Mhm.
intensive, especially since I was having some people come see me from at a province. So like, they would have been driving 4, 5, or even more hours to see
Right.
me. That they're going to need to stay in the city
Sure.
anyways. Why not maybe make it easier for them? So I just reached out to the owners of the Airbnb. I did stay there just to kind of like test it out. And then I reached out to them afterwards, pitching them the idea of collaborating. So I have a discounted rate for my clients to stay at this very fancy
Oh,
Airbnb.
cool. That's so
Yeah,
nice.
so that's kind of like our partnership. And it kind of works out well because I don't typically do intensives on the weekend, maybe sometimes on like a Sunday, Monday, but not like
Yeah.
all weekend. So
Right.
for this Airbnb, their least busy time would be during the week. So
Sure. So it's
I'm kind
perfect.
of,
That makes so much sense. Yeah.
yeah, I'm kind of helping them fill their time, and
Yeah.
they're also being very kind to me to give me like a much cheaper rate to stay at this very luxurious
Awesome.
Airbnb. So clients, if they want to have somewhere to stay if they're coming from out of town, as well as if they just want a premium experience, they could book the Nordic Spa for our intensive, and I would go to the Nordic Spa, which is 10 minutes longer of a drive from my office, so it's no big deal on my part. And they could do the Nordic circuit, before, in between when we take our break, afterwards, in between intensive days, whatever, however they feel so inclined to do
Yeah.
so, and just kind of have that space for themselves while
But
they're,
the Nordic spot, is that you mean at the Airbnb or is that a totally
yes,
separate? Okay. Okay.
it's
Yeah. Yeah.
right, yeah. So there's an infrared sauna inside.
Oh my God.
There's like a barrel traditional sauna outside. There's the hot tub on the deck, and the cold plunge is outside, and the
Oh my
fire pit and
gosh.
stuff. It's really, really nice. Yeah.
Wow.
Yeah,
That's
just
amazing.
renovated. Like this business, I think they've only been in business for a year. Like it could be at a Pinterest. Like I think the person who owns it is like a designer, because like there's a lot of intention put into behind it. And I'm like, man, it's gorgeous. So
That's so
yeah, that's
cool.
exciting.
Yeah. Awesome. I think that how many people have you had take advantage of that? Have you had a couple people do it or?
Only one. I just started putting it out in October, November. So yeah, only one person's taken me up on it so far, but I also haven't been really like, you know,
Yeah.
pushing it, or like
Right. Right.
I
Right.
just made the flyers up around Christmas time. So
I'm
yeah.
I'm curious. The person who did it, what was like, obviously not clinical details, but like
Yeah.
how many days and what was it like for them and what was their feedback? I'm curious.
Yeah, so the person that did it, so yeah, they were in the situation where they were coming from like a significant distance for this, like
Mhm.
would have had to stay like by a hotel or another Airbnb anyway. Yeah, and for them, they appreciated that it was like their alone time, kind of like having it separate and like feeling like it was like a tranquil atmosphere. They liked the saunas, and they liked the amenities,
Mhm.
and it was also an area that they were familiar with and they had positive memories around, so that was also
Nice.
nice to have.
Kind of resourcing built in.
Exactly, yes, yeah, it wasn't like a, yeah, and just it's just a nice spot, like I mentioned, like my where I live is like I could drive 15, 20 minutes to the ocean. There's like multiple
Mm.
beaches around
Beautiful.
my home, so like that's a huge privilege. And like, yeah, you could look out the window and like see the ocean from this Airbnb, and just like walk down to the boardwalk and stuff.
Oh,
So yeah, like it's just like a great location. It's also not too far from the airport. Um, if you were flying in, like
mm.
it just
Nice.
works. So yeah,
Yeah,
the combination
yeah.
is really good. So they had some great things to say about the spot.
Cool. Awesome. And I love too sort of the idea of like collaborating with other local businesses. Like that's really cool.
Yeah.
And the other thing I was wondering have you had clients who have done like say any of the treatments in your um I forget what you called it, but the holistic
Mm,
health center that you're part of. Have you had therapy clients use those uh services, during an intensive or while you're working with them?
yes. Yes, I have.
And what have you I'm just curious, like, have you noticed how that has facilitated their healing or has that been mentioned or, I'm just wondering how that worked, if that felt like.
Yeah, yeah. No, I think people appreciated like having, again, like kind of that extended time just for themselves, as well as like the therapeutic benefits of the treatment. I will
Mhm.
say that one individual did cupping, like fire cupping beforehand, and they were kind of saying like, as we do phase 6, we do like the body scan. They were saying that like, okay, like I'm not sure if this is like tension from the cupping or not, because the cupping was pretty intense. So
Mhm.
that kind of like prompted me to be like, okay, unless like you're really like gung ho on like fire cupping, maybe don't recommend cupping beforehand, because they were like very sore. Like they got that done on their first day, and the second they were like, yeah, I'm still sore from the cupping. So I was like, oh,
Oh,
okay, maybe that was like a
wow,
little bit
yeah,
too hardcore of a treatment. But yeah,
yeah,
definitely the massage and the acupuncture.
cool.
People reported that, yeah, they had positive things to say about the providers and the treatment, and just like, yeah, they kind of really, it seemed like kind of the long and the short of it was like people really felt like it was like a day for them, and like not just focusing on like the, mental health side of things, but also like the physical somatic,
Yeah,
the
totally.
body. And yeah, it just kind
Yeah,
of felt extra, just a little extra, I guess.
yeah, and I think it would, like, just because, there's like trauma informed approaches in those body work modalities, and I just think it could be interesting to think about, like, I don't even really, I'm just sort of spitballing here, but like, what is it like to have a massage before the trauma processing? What is it like to have it in the middle? What is it like to have it at the end? Like, how does that,
Mm,
it would just be, I'm just interested, like, I'm thinking about it too for stuff that I want to be offering. So it's just interesting to me to think, like, how you could frame the different treatments as supportive of, it doesn't have to be, but I'm just kind of thinking, like, what would it be like to have that real somatic release from a massage after you've done some very heavy trauma work versus what is it like to think of it as sort of a preparation because you're getting into your body. I mean, I think it could work in all sorts of different ways. It's just interesting to think about. So
absolutely, yeah. On that note, I've also had a few clients like do like a yoga class, like not like a hardcore like
right,
put
sure.
your leg behind your head kind of class, but like more of like a yin style flow.
Hmm.
And they had positive things to say about that. Not sometimes people have intentions and they're just not up for it, which I'm like glad they're respecting that. But for others, they found just having that like gentle movement and stretching to be beneficial, whether it's on their own, like with like a YouTube video, or like they've done a class in the area and they've found that really helpful as well.
Cool. Yeah, I just think there's such um possibility with this model of kind of integrating different different treatments with the EMDR, and also I think sometimes the idea of an EMDR intensive to a potential client can feel like, oh my gosh, is this gonna, you know suck me dry? Is anything about this going to be pleasant? Is this going to be just miserable? And of course we know that is not what nine I mean, I don't think I've ever had an experience where someone was like, this was miserable and I hated every
Yes.
minute of it. But, it does add this other element of, this is also can be a restorative, healing, nurturing experience. Um, it's not just like, we're going to go into your trauma, we're going to dig deep and
Yes. Intense,
Yeah, yeah, yeah. So, yeah, the word intense, right? Everyone's like, "Ah," I mean, it is intense, but it could be crafted in ways where there's, like, I've thought a lot about integrating kind of like nature therapy and
Mm.
movement in that sense of, like, what if we snowshoed for part of because my office is right on this rec path. It's beautiful for,
Oh,
I mean,
love
people
it.
cross country ski too, but that's variety, you could certainly walk during the summer and then snowshoe during the winter as both very, like, gentle, accessible forms of movement. But and that natural bilateral, and
I was thinking
anyway,
that too.
yeah, yeah. So um anyway, just, I think there's lots of cool ways to bring it all together,
Yeah.
and have it be that multi-sensory experience, because when we're trying to get people somatically connected, ideally there's a lot of we're using lots of their senses, and so just different ways to do that, I think, is cool. And I think there's a real hunger for that in the client population, of feeling like, I'm getting this very, very multifaceted experience that also has really transformative outcomes. uh,
Absolutely.
and like taking this time to really devote to healing, and self-care is such an overused term, but like literally caring for the self in a lot of different ways.
Yes. I like self-prioritization.
Yes, yes, that's much better, because self-care has become so co-opted as like an icky term. uh,
Yes.
but yeah, self what did you just say? Self
Self-prioritization.
prioritization. I was going to say self-preservation. Self-prioritization, yes,
Well, yeah.
exactly. I mean, yeah, so I like that. And I think, life continues to become more and more chaotic and stressful for all of us, and so really carving out intentional space like that, where there's a lot of opportunities for healing, I think, um, and connection in different kinds of ways.
100%, especially with like I know it's been such a topic of conversation like AI and like these services that rhyme with Setter Schmelp,
Yeah.
that like kind of just like, text or like, internet based, and like there's been some people who have voiced concern about like job security. Personally, that's not something I worry about at
I'm
all
not
because
worried about it
especially
either.
with these types of experiences, like, it's just so not cookie cutter. It's so innovative, outside the box. It's also, like, very much, like, evidence-based and, like, safe and, we're providing a clinical legit service too. But yeah, I love how creative, just like how you described, like, the snowshoeing or, like, drumming or, all these, like, different forms of BLS or
Right.
DAS.
Art therapy.
Yeah.
I just did a little training. I took a training on EMDR with kids, not because I work with
Ooh,
kids, but and maybe I will at some point, but because I'm very interested in integrating play into my intensives. Like
yeah.
I have found that since having children, I have like reconnected with the joy of like playing with toys because I think you kind of have to like survive parenting.
Yes, those
But like
magnet-tiles.
right, I love magnetiles. Honestly, is that what did you say
Yeah,
magnetiles?
I
Okay,
did.
I love magnetiles, and we have a ton of them. And like once my kids age out of them, which will still be a while, so maybe I'll have to do this sooner. I'm bringing them to my office because adults love using them, and there's this like tactile create. I don't know. I just it would be a way to like integrate play where I don't feel like you have to have done 5 million years of training, but just like not to that's another thing I love about EMDR training is because I think we get so sort of somatically attuned that we're able to like see be like, oh, I see why play is something that would of course connect you with your right brain, like connect you with the unconscious. Like that's what we're trying to do. Um and so just bringing in lots of different ways to do that. Like I am not an artist by any means, but like there are ways to bring in art and creation into therapy sessions even if you're not don't have a degree in art therapy, which is not to say that I have immense respect for, you know what I'm saying? All that stuff is true, but
Yes.
like I think we sometimes can fear that we're not allowed to do X because
Mm,
we haven't been fully trained in X. And it's like I
right.
think if you're using your clinical judgment and you're like not going outside of your scope of practice, there are tools that we can all bring in that and I'm not going to be out there advertising myself as an art therapist, you know.
Exactly, yeah, exactly.
But of course I have crayons and Play-Doh and markers in my office, you know what I mean? And so I just think, and I think intensives give us so much space and time to like be creative and pull on different things and like use a sand tray and all that kind of stuff. Like, why not, right? Why not have all those tools at our disposal? And I think if we're coming at it from a clinically grounded place, like I'm having this person do sand tray for a clinically grounded reason, then we can do it. that
Oh
was a
my
little
gosh.
that was a little tangent there, but something I've been thinking about.
Absolutely, yeah, and it feels right, Sometimes it just
Exactly.
feels right.
Mhm. Right. Like I'm not a yoga teacher, but I will get us up and move. Like, you know, like I can barely touch my toes, but I'll still have clients like do some movement because we know that moves things through the body. We know it does. We know that helps us connect somatically, So there's just, I think, kind of the conceptual and theoretical framework of any kind of neurobiology bottom up based approach helps us understand how to bring in all these other tools in a way that I didn't when I was just doing CBT.
Yeah.
So it's about having that when you have that comprehensive understanding, I think, of the nervous system, it allows you to bring in lots of other things.
It's just so nourishing for our therapist souls too to, like, just
Absolutely.
expand in that way, and it's so anti-capitalist to, like, bring these things in. And oh, I just this the conversation right now is just making me excited. So
Yeah.
it's just that just
And
tells
like
you everything.
I think too, like it's it brings a sense of play for us, which is so important. Like I'm going to
Mhm.
try this. I'm going to experiment with this. Like as long as we're attuned to our client, if we're seeing things are getting a little off the rails, okay, we know what to do. We back off. We reconnect. You know, we help them soothe in the moment. Nothing terrible is going to happen. you know.
And maybe,
Uh,
like, that's exactly what we need during this difficult time is, maybe less cognitive interweaves or, like, those types of interventions, maybe less talking or less
mhm.
news watching and more play, more of these types of interventions that just there's no words, but it can be just so healing for the soul and the mind and rejuvenating for the work.
Exactly, and just like helping us connect with ourselves, which this world and this constant news cycle takes us away from, right?
Oh,
It's just,
yep.
it forces us to dissociate to survive, and that's harmful in the long run. you know, that's, you know,
Bring on the
wow.
magnetiles.
Yeah, Magnetiles, maybe. I have great plans for them.
Mhm.
Good thing I've invested a
Sponsor
lot of money in them over the years.
magnetiles. If you're listening, sponsor Dr.
I
Solo's
know,
podcast.
exactly. And I should have saved my receipts so I could write them off on my taxes, but I will next time.
Yes.
Next time I buy more Magnetiles. Yeah. Oh, yeah, exactly. Well, I do want to be mindful of time because I know both of us have stuff coming up very shortly. But I believe, am I wrong about this? Have you been doing some other trainings for therapists or kind of like consultation on social media, or is that somebody else that I'm thinking
Oh,
of?
yes, that is me, but I would not say I'm some sort of like business coach extraordinaire expert. Yes, I did do and have one in the works around. I did a training a few months ago on social media for therapists just because like geez, like I've been on social media as a therapist for I think 2 or 3 years now, but like it's still not easy for me or like it does there's always still like that little bit of like doubt or like is this okay or like am I doing something wrong? Is this am I portraying myself in a way that's conduct becoming of the field? You know, I mean there's a lot of
Yeah.
anxiety there. Even though I
Mhm.
am like a friendly social person in real life, it's still tricky to navigate. And so I thought that it would be beneficial just to kind of share what I've learned and also some of the
Yeah.
pitfalls that some therapists could potentially get into or have been, you know, based on like kind of complaints and stuff on licenses. So I
Mhm.
did a course on that.
Cool. That's awesome.
It is available for purchase if you like, you know, just reach out
Good.
to me. Um,
Yeah, I'll put all the details in the show notes so people can look it up for sure.
and I'm doing another one. I'm just kind of collaborating with our professional development consultant with our College of Social Workers here in Nova Scotia on it is going to be like on marketing for therapists, like ethically, kind of ethical considerations.
Oh,
Um,
amazing. That's
because
awesome.
especially it can be kind of confusing sometimes because there can be differences on what's allowed or ethical in between colleges. For example, like for social work, you know, it's unethical for us to post like client testimonials or to like
Right.
accept them, right? But for other professions like physicians, there's some stipulations in their uh, guidelines in situations how they can do that. So like that's what our discussion is going to be about.
Oh, cool.
So I'm kind of preparing that right now with our college.
Awesome. When is that going to be?
We haven't set a date yet. I have our first planning meeting in March, so I imagine probably won't be for a few months.
Yeah. That's so cool though. I think that's something that's not spoken about a lot is the ethics around social media marketing, and not in a scary way, but in like you want to feel good about what you're doing in that regard, and it's okay, and there are things we should be thinking about. I think that's really awesome. So I'm glad that you're doing that because I think, there's a lot of talk about social media marketing out there, as we all know, but it's much more focused. It's very there's very little about the ethics piece. I mean, people are always like, oh, don't post client testimonials, but even beyond, there are more ethical considerations beyond that too,
Yeah,
and just how it feels to you. Does it feel like values aligned? And like that's an important consideration. So I think that's
absolutely.
really good, a really important part of the conversation.
Thank you. Yeah.
So yeah, because I think in some ways, like when I was in school, it was like you never have any online contact with anyone who could potentially be a client ever. And in some ways, I see the pendulum like shifting maybe a little bit too far in the other direction at times,
Mm-hmm.
which is what happens, I think. But like I think there's a little bit of a course correction needed, and I think it's more about like checking in with yourself about what feels good. So I'm glad you're having that conversation because I think it's really important.
Yes,
um,
so much more gray area as technology advances, for sure.
yeah, yeah. Well, I have to ask the question that everyone says, where, and I'll put this in the show notes too, but where can people find you?
People who seek to find me can look to
Western Sky, no,
Instagram.
Eastern Sky.
I guess that's probably easiest. It's at sam.the.shrink. I just thought that was like a funny tongue-in-cheek
It
name.
is very, very memorable.
And I mean, if people still use Facebook, you could look up my practice. I pretty much just share the same things. It's Following C's Psychotherapy on Facebook.
It's a lovely
If you
name.
feel so inclined, or yeah, that's pretty much it.
Awesome. Well, we'll make sure that's in the show notes. And thank you so very much for your time. This was so lovely to have this conversation, and I know people will really, really enjoy it. These interview episodes are always super popular because we're all so excited to see what other people are doing, and So thank you so much for being willing to do this.
You're welcome. And thank you, Carolyn, for providing the space and being one of our, pioneers in intensives.
Oh,
I truly
thank you.
admire and look up to you. So thank you so much for inviting me.
Well, it's my pleasure, my privilege. All right, everyone. Thank you so much for listening, and I will talk to you all next week. Take good care, everybody.